Good evening, and welcome to MHC on the Rise, where it's our goal to create positive conversation and find solutions to the issues that impact Martinsville, Henry County. I'm your host, Garrett Dillard, and tonight we're discussing Breast Cancer Awareness Month, and we have a wonderful guest with us, and she's gonna give us lots of insight. If you would introduce yourself.
Good evening. My name is Rita Winbush, and I'm with the MHC Coalition for Health and Wellness. And Garrett, I'm the project director for our Ladies First program, which is the Martinsville Henry County Community Breast Health Initiative. We're a Coleman grantee, and it's our job and our duty really to kind of educate and create awareness about breast cancer here in Martinsville and Henry County.
Well, great, and I had the privilege of working with you some last year. You all assisted with an event that we put on at Bassett High School. And can you tell us why and how your initiative started in Martinsville, Henry County?
Sure. Unfortunately, Martinsville and Henry County ranks very high in the state of Virginia as far as women presenting with late-stage breast cancer. A lot of that is due to lack of insurance, due to high unemployment rates. So Martinsville, Henry County, as well as Pennsylvania County, has really been identified as a high priority area by our primary funder, which is the Susan G. Komen Virginia Blue Ridge affiliate out of Roanoke. So because of that reason, we've been able to receive grant funding to provide education outreach, as well as pay for screenings for uninsured women. But the program actually got started back at the hospital before the Coleman grant even came on the rise. At the hospital, there were some employees who wanted to help out women and help uninsured women, so they began a program called Cancer Screenings for Underserved Women by CSUW, which internally we still refer to it as CSUW. And then when the opportunity came to get grant funding to expand this program and to offer the service to more and more people in Henry County, the coalition took on that initiative to apply for grant funding.
Okay, and you mentioned grant funding. Do you want to elaborate on that some as to where your grants come from and how other ways that you fund the program?
Absolutely. As I mentioned before, the Susan G. Komen for the Cure, they have different affiliates around the country, and the affiliate that covers our area is based in Roanoke. It's called the Virginia Blue Ridge affiliate. So that's where our primary funding comes from. We are actually in the middle of this grant cycle and are set to apply for next year's grant. That application will go off in December. So that's our primary funding for really covering the overhead of the program as far as the marketing, the outreach, personnel, as well as the screenings, the education materials. We've also been fortunate enough to receive grant funding from the Martinsville Area Community Foundation. And Garrett, this is where we're really, really excited because the community has stepped up to support this program. Everyone's affected by this. So Martinsville Area Community Foundation, 100% of that money goes directly to patient care. We've had so many people to donate funds to us, so many organizations to raise funds and host events. So we're really excited. I write about that in my reports, how the community has backed the program.
Well, that's awesome that everyone is getting behind and supporting your program. Who is, you mentioned uninsured, but who all is eligible for your program?
Okay. For the Ladies First program, anyone is eligible for the education. We target anyone. We target women, we target men, we target children, we target influencers for this. We target people who have the ability to refer other people into our program. In regards to the screenings, where we pay for the screenings, whether it's a screening, diagnostic, ultrasound, for that, we work with uninsured women. Generally, the guidelines are age 40 to 64, because at age 65, a woman should have Medicare, which it covers. Under 40, we will take those women into the program as well if they're symptomatic, if they're referred to us by their doctor, primary care, or OBGYN. Or if they have a very strong history of breast cancer and perhaps a relative's oncologist recommended that they start screenings early for that. So we do look at income for that. Generally, it's 200% below the federal poverty level. if someone is ineligible for our program based on income, we have other resources that we look towards to try to move them into, as well as the hospital actually offers a discount rate for self-pay for those people who do not qualify. But most uninsured women in Martinsville and Henry County that come through, they qualify for our program. So we want that message out there.
So what is the first step if someone would like to get support or assistance from your program? What would be their first step?
Okay, their first step is really the primary care or OBGYN. We want an order from your doctor to write an order for a mammogram for that. If they do not have a doctor in the area, they just get in touch with us. We can help them get into primary care to get the order, or to one of our partners, at the health department. We work with every, physician here in the area. They refer their self-pay or uninsured patients to our program.
Okay.
Let me just say, this is a community grant. Okay, when we apply for this grant, it is for anyone in the community, even though we host it out of the coalition. So regardless of who your provider is, he or she can refer you to our program. So the first step really is to see your doctor to get a clinical breast exam, or call us and we can assist you in getting that order. Once we receive it, it's a very turnkey process, and the providers love this because this is an avenue for them to offer diagnostic services to their uninsured patients.
Absolutely.
And so the doctor sends the order to us. We do the eligibility screening. We make the appointment with the breast center, and the report goes back to the referring physician.
And we'll give you a chance later to give some information as to how people can contact you. But just to be clear, your ladies first, it's they educate as well as assist.
Absolutely.
Okay.
Absolutely. Our goal is to try to reduce the risk factors, to help women reduce the risk factors and know what they need when it comes to breast health. Know what the risk factors are, know how to reduce those, know what to check for normal, advise when to get your screenings, how to live a healthy lifestyle, those things that contribute. Our goal is to create awareness. We sponsor a lot of awareness events. We do a lot of outreach in the community with civic organizations at the churches, just letting people know that this service is available and also provide the educational materials. But again, we assist in getting the actual screening. We will pay for the screening. To go towards a little bit more towards sustainability, we included a slight copay for repeat patients this year. It's nominal, and if there's hardship, we waive it for that. But this allows a lot of our patients to be able to pay a little bit on their own, as well as to be able to help someone else, a new patient come in.
That's great.
And the women, we find, are very receptive to that.
So your advice would be, if you are in doubt and if you're unsure if you qualify for the program, apply. And you all will assist from there.
Call us. It's a very easy process. We have simplified. It cannot be any simpler. There's like 5 questions perhaps for that, and we work with you to gather whatever support we need for that, and we've done it long enough to know right off for that. And like I said, very rarely do we have patients who come through who are uninsured. And the majority of our patients are working women, and we'll talk about men too. But either their employer does not offer insurance, or they cannot afford insurance, or perhaps they're working part-time jobs or not working full-time where that benefit is available to them.
And we're going to stick with breast cancer awareness, of course, but of course, this time of the year, October, I mean, everywhere you go, it's pink.
Yeah.
Can you give us a little history of National Breast Cancer Awareness Month?
Sure. I know. Well, we believe in awareness all year round, not just in October. So that is one of the things too. But I love pink now. My wardrobe has changed quite a bit since I've become involved with this program. But as far as the Susan G. Komen program, it actually all started when Nancy Brinker promised her sister, Susan G. Komen, who had breast cancer and had a long battle with breast cancer, and unfortunately she lost that. But she promised her sister she was passing that she would do everything she could to help eradicate breast cancer. And it started as a grassroots effort, and pretty much everyone knows Susan G. Komen and knows the pink ribbon and pink in October. So it started, like a $22,000 grant, some funds, and now they've donated billions of dollars to research, to assisting with providing screenings for uninsured or for insured. So many support groups, but any information you want on breast cancer awareness, how you can get involved, if you're diagnosed, treatments, research, just go to Komen.org. Okay. Everything is there. It's a beautiful, great website, but every topic is covered. So that's kind of how it started.
Okay, and of course, you mentioned the pink, and how did it become a national phenomenon that, everybody would wear pink? I mean, you watch football on Sunday.
I know.
Baseball on Sunday evening.
NASCAR, big sporting event, big national manufacturers, and you see it in advertising. You see a lot of fundraising from consumer products as well. Breast cancer is something that affects the entire household when a woman is diagnosed. And it's something that people can identify with. You hear about it more and more cases of diagnosis for this. This is something that people can get behind. The degrees of separation of knowing someone who's been affected by breast cancer are very, very small now. Okay. Anyone you talk to can probably tell you they know someone who's been affected by breast cancer. So this is something that people can get behind. They've had a lot of, like you said, a lot of big organizations to carry that torch, and that filters down, and people want to take part in something like that.
And as I was preparing for the show, I read somewhere where it talked about, there are some critics of the pink because some people, assume that they put on their pink T-shirt or they wear their pink towel and they are, making a difference.
Right.
But, can you talk about that some and, the pink, and can we do more than just put on the pink T-shirts?
Right. Absolutely. We can all do more, and more is needed as well. It's good to show support. It's good to participate in awareness for that. But funding is really the key. Funding for the research to find a cure. This is what the whole program is all about. It's not just for fashionable or what other product you can make in pink or sell in pink or anything like that. It's looking for funding to fund research for this, as well as to provide assistance for those who need it, those who've been diagnosed, or to help prevent those from being diagnosed for that.
We're going to take a break here, but when we come back, we'll discuss some of the organizations and some of the ways that we here in Martinsville, Henry County, can donate to the cause.
Okay.
We'll be back in a few minutes.
Hi, I'm Nick Bello. You might know me as the Credit Master. We have cars all over the place here. We have hundreds of them. From this 2011 Corolla right here with only 21,000 miles, 36 miles to a gallon. I'm the Credit Master, Nick Bello. Find out firsthand why they call me the Credit Master. I've helped thousands of people just like you in the past with credit issues such as bankruptcies, divorce, layoffs, repossessions, and slow pay. So call me and find out firsthand why they call me the Credit Master.
You're watching VTW 21, your neighborhood network, the pride of Martinsville and Henry County.
For over 80 years, Martinsville First Savings Bank has called Martinsville home. In this time, we've gotten to know our customers personally. Our interest is in Martinsville, in the people and businesses of Martinsville. And because we're a part of the community ourselves, we have a stake in the people around us.
Though we've changed our name, our goal is the same, to always put Martinsville first.
Local high school football only on your neighborhood network, Monday nights at 9.
Getting the kids ready for for school can get expensive. That's why during the summer clearance event, Jim Mills Chrysler Dodge Jeep Ram is offering the best pricing of the year on all remaining 2013 fuel-efficient vehicles, saving you money monthly on payments and at the pump, like the 31 MPG Highway Chrysler 200. Purchase yours today for just $19,999. Plus, don't forget about Jim Mills lifetime warranty, giving you total peace of mind for as long as you own your vehicle. But only from Jim Mills, the name you trust. Visit JimMillsChryslerDodgeJeep.com today.
Martinsville and Henry County. If we love this place, let's keep it clean.
School can get expensive. That's why Jim Mills Nissan is offering the best pricing of the year on all remaining 2013 fuel-efficient vehicles, saving you money monthly on payments and at the pump. Like the 38 MPG Highway Nissan Altima, now just $19,999. That's right, $19,999 or just $297 per month. Plus, don't forget about the Jim Mills lifetime warranty, giving you total peace of mind for as long as you own your vehicle. But only from Jim Mills, the name you trust. Visit JimMillsNissan.com today.
Welcome back to MHC on the Rise. You can find us here on Monday nights at 8 p.m. I'm your host, Garrett Dillard, and tonight we have Miss Rita Winbush of Ladies First, and we're discussing Breast Cancer Awareness Month. And, you know, I'd like to just mention two names of family members, Miss Sherry McDaniel and Miss Angela Coleman, and I have other members that I know have been diagnosed with breast cancer, but how many people here in Martinsville have been diagnosed with breast cancer?
Breast cancer. As I mentioned before, you know, this is a high priority area because of the number of women presenting with breast cancer, but presenting with late stage breast cancer, which is a big problem. So that really is the reason that we're offering these screenings and free screenings, because, you know, the stats are showing that early detection really makes a difference. But in 2012, there were close to 66 women in Martinsville and Henry County that were diagnosed with breast cancer. So that does not include the women that were diagnosed outside of the area. Perhaps they were going to a medical facility in the regional area. That's a high number, Garrett, more than we want here. So we see that there are some, you know, disparities there as well. So, you know, if we can, you know, if we can get women in early, so many changes in the treatment options, you know, have become available that the earlier the diagnosis is made, then, you know, the more options there are for treatment and success.
And I'm sure you recommend regular visits to your doctor, but are there any early signs or symptoms that, you know, women should be on the lookout for?
Well, you definitely want to know what your risk factors are, and so we always recommend that you know both sides of your family history. Although one misconception out there is that, you know, that you have to have a strong family history of breast cancer, and really probably about 5 to 10% of diagnosis really run in the family, or you know, family history. There's a evidence of family history there. But you do want to know that information, and you want to talk to your medical provider about what your personal risks are, and take a look at what the risk factors are and work on reducing those risk factors by living a healthy lifestyle, you know, with your diet and nutrition. And I think that, this is one of the services that we offer here, is try to help women come to that conclusion. As far as signs and symptoms, every cancer is different. Breast cancer is different. It can manifest itself in certain ways. So what we really try to teach is know what's normal.
Okay.
Know what's normal for you. And then if you're seeing changes, for that, that's when you need to report those changes for that. But if you feel a lump or hard knot, if you have changes, in your breast or swelling or, discharge change in the size, but if you know you're normal, you can tell when there's something wrong, and then you want to present to your medical provider right away.
Okay.
For that too. But again, to pick up on most of this, the screening is what's going to pick up on a lot of it.
Okay. And where would you recommend going for the screening, and how frequently should women go for the screenings?
Well, we work with the Julius Hermes Breast Center at Memorial Hospital in Martinsville, and they are a huge supporter of our program. Without them, we just couldn't do what we do. We have a great working relationship with them, so we send our patients to there for the screening. But the start out point is with with your doctor, with your medical doctor, with a referring physician, and they'll write the order for that. As far as the frequency, it is recommended that beginning at age 40, that women have an annual screening or annual mammogram. And starting at age 20, women should have a clinical breast exam once every 3 years at least. There's not as many cases of cancer being diagnosed in women under 40, but there are cases, and we've had several cases here in Martinsville and Henry County. So know the normal, know if there's something different. If there's something different, we need to act on it right away.
Okay. And you mentioned diet and a few other things. Are there ways to prevent or reduce the chance of acquiring breast cancer? And can you elaborate on some that you've already mentioned?
Right. Well, reducing risk factors not only for breast cancer but for all cancers as well as chronic disease. It's been recommended that you avoid a sedentary lifestyle, so that means being active, exercise, as far as your diet, a high fiber diet. Nutrition, not smoking, limited alcohol intake, all of those things are just living well. And so one of the things that we try to do is to really refer people into the available resources here in the community and encourage those resources. Some of the other initiatives with the coalition, like the aerobics, the free Zumba, that's a great way for exercise here. We have the walking trails in Martinsville. We have the bicycle options. We have, the canoeing. We have all opportunities for exercise. We refer people into the Virginia Cooperative Extension Nutrition Program. There are nutritionists in the area to help people with their diet for that. So that's one of the services that we offer, is to try to network our patients to available resources that are already in the community.
And as we, get close to closing out the show, I would like for you to mention some of the events that are going on, for the rest of this month, that we can get out as citizens of Martinsville, Henry County, and support.
First of all, I have to give a big shout out and a big thank you to everyone who supported the program over the past few years. And each year, more and more organizations and businesses and individuals are stepping up to support. This past Friday, Piedmont Fine Arts, they had the pink party, which was fantastic. I love a party with a purpose, and it was a good party with a purpose. The Ridgeway Rescue Squad, they do a motorcycle ride for us every year. This is the third annual. It's called Cruise for a Cure. That's on the 19th. But the high schools have stepped up. Bassett has done that before. They're doing it again today. They're having the pink out for that. We've had, tennis organizations with the country clubs. We've had elementary schools to donate for this. And, churches, I went to a great program yesterday, a church, they were honoring survivors.
I participated in a program this weekend. I'm still feeling the effects, but Gospel Light Holiness Church.
Well, that's the church I was at yesterday. So
awesome,
yes,
awesome.
very good.
And they had a program in Eden, North
Right.
Carolina, and had a basketball
Right.
tournament and
So you played
raised lots of money.
money.
I tried to play. I'm not as young as I used to be, but it was all for a great cause. So the back and the knees and everything else that's hurting it was well worth it.
Right. That was the church I spoke at yesterday, and they had the 3-day event, and we partnered with our peers out of Moorhead as well, who have a similar program for patients and consumers in Rockingham County. And at the service, they did the entire weekend. They had an event on Friday, on Saturday, and then the service yesterday. But they actually have 8 survivors in that in that church, and that's one of the things that people can do, is to help support survivors.
Absolutely.
And this is what you'll see survivors doing now. They're trying to pave the way and to help other people that may walk in their path as well.
Well, great, and you've given us a lot of good insight, and do want to get ready to close out the show. So if you'd give us some final thoughts, some contact information, and anything else that you would like to leave Martinsville, Henry County with.
Okay. Again, thank you to all of our partners with the health department, Memorial Hospital, everyone who's just really stepped up with the program, the staff. Some final thoughts: get screened. Get screened. If you're uninsured, or even if you are insured, take advantage of that and get your annual screening. This is not something to delay or to put off for that. We also encourage you, if you're uninsured, to take a look at getting insured under the Affordable Care Act. That is one of the things that is covered under the Affordable Care Act, this preventive screening such as this. If you're interested in that and need more information, just give us a call at the Coalition. We have certified assistance counselors, as well as other organizations in the community who have those CACs you hear about on the news. We can help you kind of navigate your way through looking at some of those options for that. But that's one of the big benefits of the Affordable Care Act, is that preventive is covered. So again, if you're interested in supporting a cause, we can tell you that 100% of all donated local funds go directly to patient care. Nothing goes to overhead, 100% goes to directly patient care.
And Martinsville, Henry County, I would like to thank Ms. Rita Winbush of Ladies First for providing us with some great information tonight. I also ask you to tune in next week, where we'll discuss parenting and ways that we can all continue to grow as parents. And as always, let's continue to look for solutions to keep MHC on the rise. Have a great evening.
Very good. Excellent. Thank you.
Thank you.
Getting the kids ready for school can get expensive. That's why